Hello everyone, thank you for joining, and we are back with Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and I get to answer your questions. And we are back with our series, What to Expect series. We've been doing this topic for the past few weeks and it's been very good because it is more focused on patient experience and the symptoms or the things that usually they go through after the surgery rather than the science behind it. So today we are going to be focusing on semaglutide. So I don't know if you heard, but we started to offer here at the Pure Aesthetic Center, semaglutide injections for weight loss. So I wanted to go over the what to expect on semaglutide, talk a little bit about what it is, and then get to answer your questions, okay? So let's start with what is it, okay? So semaglutide is a weekly injection. This is the fancy medical term of it. It's glucagon-like peptide 1 receptor agonist. What does that mean? It's a hormone. Glucagon is a hormone that our body has that helps with insulin regulation and hunger. And this medication was actually developed for the treatment of diabetes, and it's been out there for a few years, and it's been very successful with diabetes control, hemoglobin A1C control, and also the sugar, and obviously the sugar levels. But one of the things that this medication does, other than produce more insulin and regulate blood sugar, is what it's actually been doing for weight loss. So we started seeing that these patients were feeling more fuller, so they have less hunger, okay? So why? Because this hormone also regulates our hunger in the brain. So the stomach feels that it's fuller for longer than it is, or sooner than it's actually. So you're eating less amount of food and feeling fuller, or that your satiety is gone. It's at level, but with the same amount of calories. So like you are requiring less calories in the same amount of time, okay? So this is what it does: decrease hunger in a brain level and also decrease gastric emptying. So your stomach, it's fuller longer, okay? So it is a medication that it started, like I said, an injection weekly. It is very important to check a blood work before, okay? The reason for that is to check hemoglobin level, iron levels, also hormone levels. There are 2 contraindications for starting semaglutide, actually 3. One is patients with history or family history of medullary thyroid cancer, okay? Those patients are at increased risk of developing a recurrence of the tumor. So if you have a personal or family history of medullary, not the most common form of thyroid cancer is not that one, okay? So the most common form of thyroid cancer, it's called papillary cancer of the thyroid, but this one is a more rarer form, but still it's called medullary thyroid cancer. So if you or a family member, you are not a candidate to start on semaglutide. And the other one is history of chronic pancreatitis, okay? Because there is a very low risk of developing pancreatitis for patients that have chronic pancreatitis, this may worsen, okay? So those are the complete contraindications. The third one is if you are pregnant or breastfeeding, you shouldn't be started on this medication, okay? So those are the 3 contraindications. If other than that is if you want to lose weight, if your blood work is within normal limits, and very, very important, and like anything, if you are committed to changing your lifestyle, right? Because this is an injection that is gonna help you achieve that goal. But the bottom line is, like any weight loss regimen, bariatric surgery, any diet that you do, if you don't change your way of thinking and you change your relationship with food and exercise, you are going to rebound and gain the weight afterwards. That's the reality of it, okay? So if you start, yes.
If you can do a short resume of what you're saying, de lo que está diciendo en español, que todo lo que está conectado dice
español, ok. Seguro que sí.
Una versión cortita.
Ok, so lo que estoy hablando es de semaglutide. Semaglutide es un medicamento inyectable que se utiliza una vez a la semana, se desarrolló inicialmente para el tratamiento de la diabetes. ¿Por qué? Porque lo que hace es actúa a través del receptor del glucagón, que lo que hace es aumentar la insulina y bajar el azúcar en el cuerpo. Pero esta hormona también regula el hambre. Así que lo que se ha visto es que al tú inyectar esto manda un mensaje al cerebro de que estás lleno más rápido y no te da tanta hambre, no te dan lo que se llaman los cravings, que quieres estar picando o comiendo todo el tiempo, y lo que comes se te queda en el estómago más tiempo, así que no tienes que comer tantas veces al día y las porciones son mucho más pequeñas y no tienes hambre. Así que eso es lo que estamos hablando. Good. Okay, I'm going back to English, pero si tienen preguntas me las pueden hacer en español y yo vuelvo y explico en español. So what I was saying is that the most important part is the lifestyle changes, okay? Lifestyle changes, again, super important. Okay, so when we did the labs, we can start the medication. We obviously check a BMI, okay? So checking your goal or your starting BMI and weight and what is your goal. And we're gonna start in lower doses, okay? Why? Because if we start in high doses, then the side effects are gonna be more, okay? What are the side effects? Same or related to the satiety and the decreasing gastric emptying. So you're gonna feel full, you may feel a little bit nauseous, okay? So it's very good to start at lower doses, okay? When we start that way, your body gets used to the medication, and then over a period of 3 to 4 weeks, if you're tolerating that dose, but you're still hungry, then we can increase to the next level dose, okay? And that up to the level, so how much, there is obviously a safe range, okay? But it is pretty wide, okay? So how much do you need to go up? It depends on how much hunger you have, how much you are close to your body weight, and how much are you tolerating, because you still need to get some calories in, right? So it's like, I'm not eating for the next 2 weeks. No, you still need to get calories in, and that's why doing the blood work and checking your vitamins, vitamin levels, it's very important, okay? So like I said, you're gonna be like 3 to 4 weeks in a certain dose and then increase it slowly to tolerate more. But these are the most common symptoms or side effects of the medication. But they're very tolerable if you do it slowly and progressively, like I mentioned, okay? So what to expect on the time frame, okay? So usually people lose very rapidly the weight, okay? So majority of patients start losing 5-10 pounds the first few weeks, maybe the first month, okay? Then afterwards, it depends on how much weight you need to lose, right? I started the medication 3 months ago. I've lost 15 pounds, but that was my goal, to lose the 15 pounds. It was my baby weight. So I didn't lose more because I didn't want to lose more. I don't want to look in the other side, you know? So I'm happy with my current weight. But for example, my husband started at the same time and he has lost 40 pounds because he wanted to lose a lot more, okay? So it just depends, okay? He is in a higher dosage, so it depends in what is your goal, and we're gonna guide you obviously in that process, okay? When to stop is the next question, right? So it's like, okay, I lost the weight, and now I'm in my goal weight. So the way to stop it is a couple of things. So one, I mentioned the lifestyle changes, right? It's very important because a lot of people say, oh, you're gonna rebound. Well, if you go back to eating the way that you were eating before, of course you're gonna rebound. You're gonna regain the weight, right? So the time that you are in the medication should be the time to train yourself and to learn how to eat healthier, what portions are best for you, and to do an active lifestyle so you can maintain that, okay? And then once you reach your goal weight, you have to wind down the medication. You shouldn't stop it in the same, like that week, okay? So the same way that you started gradually to avoid the side effects, you should then stop it gradually to avoid that rebound hunger, okay? It's like retraining your brain to go back. but still maintain those portions. You learn what was the portions that you should be eating, so maintain those portions so you can keep those results, okay? I'll get some questions now.
Okay. If I need more information, how can I do?
So give us a call, okay? So the two easiest ways is either give us a call or go to our website. There's a link of request a consultation that is shorter than the virtual consultation form, okay? You don't have to send pictures. You don't have to fill all that long. It's a shorter questionnaire. You fill that in or just give us a call and we'll give you all the information that you need.
¿Cómo es entregada la medicina?
Sí,
supongo que pregunta si es tomada o inyectada.
Sí, es inyectable. Es una inyección que se pone una vez a la semana y te explicamos todo esto en detalle cuando nos llames o llenes el formulario. Te vas a comunicar con una de nuestras staff, de una de las coordinadoras y ella te explica todo.
I'm having surgery. I need to lower my BMI. This can help?
Excellent question. Love this. Yes, okay? But plan ahead, okay? So this medication, depending on how much you need to lose, is gonna take a couple of months, okay? To safely do it, okay? I don't want you to go from a BMI of 35 to a BMI of 30 in 1 week. You know, that's not healthy. And you are not gonna tolerate the surgery well, okay? Because you need to be healthy for the surgery. So you need to lose the weight in a healthy manner, and this medication can help you with that. But plan ahead, a couple of months before. And also, you need to stop the medication at least 2 weeks before the surgery, okay? Why? We mentioned that decreases gastric emptying. For surgery, you need to have your stomach empty for the anesthesia, okay? And if you're in this medication, you may still have food by the time of the anesthesia, even if you don't eat for 8 hours before. And there's a risk of aspiration, that food going to your lungs, okay? So that's very dangerous. You should stop it 2 weeks before the surgery. And when to restart it, if you want to, then you have to restart it at least 30 days after. Because in the initial post-op period, I want you taking good supplements and good nutrition to heal adequately.
Okay. I had a breast lift. How much weight can I lose without losing the big jobs?
Sorry.
Don't worry.
Very good question. And we're hearing a lot about this. Breast, buttock, or after BBL, also the Ozempic phase. It's been trending in social media for the past few months. Any weight loss regimen that you choose, the bottom line is the weight loss part, okay? So if you lose weight, unfortunately, your results may change, okay? Deflates, so the volume is lost and the skin may sag. If you lose between 10 to 15 pounds, usually the results or the change is not as dramatic. But if you lose more than 10 pounds, 15 pounds, then definitely you may need either an implant to achieve more volume, a lift again to tighten up the breast tissue. If it's a BBL, you may lose some fat, you may need another round. This is the reality of weight loss. So it's better to lose the weight before the surgery to achieve a better outcome.
I'm mother of 2. I'm still breastfeeding my baby child. When should I start the treatment?
After you finish breastfeeding, okay? So there is not a time frame. Once you stop breastfeeding, you may start the medication, but it's not safe to do it. I think it's not been studied if it passes or not through the breast milk, but I think the most important component of it is during breastfeeding, you need a lot of calories to produce the milk. So if you are calorie restricting yourself, your output and your milk supply is gonna come down significantly. So it's better to stop and do it afterwards.
Okay, there are other questions from other topics.
Okay, let's do it.
How long do you have to sleep in a V position at the tummy tuck?
So 2 weeks, okay? You have to be avoiding tension to the incisions for 2 weeks, and when you're walking, a little bit bent over.
Okay, I have done everything to lose weight. Nothing helps. It's more common.
Yeah, I mean, I feel you, and that's why I tried the semaglutide. Before pregnancy, I felt like I ate healthy for a week or two, and I lost weight like this. I didn't start any dieting after I delivered my baby because I was breastfeeding. I breastfed for 6 months, and like if I even ate a salad for lunch, I saw that I was producing less milk on the next pumping session. So I couldn't. I had to eat to keep the milk supply. So when I finished the 6 months breastfeeding, my breastfeeding journey, that's when I started to diet, and I was a month strictly dieting, being very consistent, and I lost 0 weight. So I got very frustrated because my husband wasn't semaglutide, and I lost like 15 pounds in 1 month, and I'm like, okay, so I decided to start it. It was a good option for me. I'm not saying that it's gonna work for everyone, but dealing or trying different alternatives is always good. Always seeking a professional like a nutritionist, it's helpful because sometimes we don't know. We're like, I'm eating healthy, but sometimes the things that you're eating, it's actually not healthy. Sometimes the portions that you're choosing is too much for you. So actually going in an evaluation with a nutritionist to check your portions, your calories, what's your caloric need. Everybody's caloric need is different. So all of that helps. So you may try that.
Age and BMI limits for mommy makeovers.
So mommy makeover, 55. I do up to 60, but it's very specific on the medical conditions and the BMI. BMI in general, less than 33.5. I do encourage everyone to at least close or lower than 30 to decrease complication rates. And if you're more than 55, I may stage the mommy makeover, breast and then tummy, or ask you to lose the weight to less than 30 BMI.
How do you shower with the drains?
You shower. You just let them wet and then pat dry it. They can get wet. Nothing wrong is gonna happen. Sometimes people do put like a little chair so you can put the drains in, or a little stool so you can put the drains there. Or if there's a shower curtain, you can clip it to the shower curtain and then shower. That's it. Awesome, you guys. So hopefully you guys learned something about semaglutide today. If you have any questions, don't hesitate to give us a call or fill that questionnaire in our website. If you have any questions, any topics that you want to discuss, always more than glad to answer your questions. Send me a DM, and I'll see you guys next week in Tuesday Tips. Take care.